to visit because we're weekend warriors, and we love to talk about all of our aches and pains and our injuries and how to ward against them. Yeah. All right, because I'm fascinated by injuries when it comes to sports because I have a million of them, right? Knees and Achilles and elbows and shoulders. Ooh. And I'm still trying because I was throwing to Massimo and my shoulder. Yeah, I was throwing to him. And I think I threw myself out.
A little rotator.
Yeah.
That's horrible.
Yeah. Oh, boy. Moss was like, I need to throw because we were working on some catch and stuff.
Yeah.
And I think so. Anyway, every week we're joined by the great doctors from the Rothman Institute. Rothman Orthopaedics is fantastic, all right? I tell you, they saved my Achilles. They've saved many body parts. And joining us right now is Dr. Matthew Pepe. Doc, how are you, buddy? What do you say, Doc?
How are you?
So first of all, I got to tell you, last week we had Dr. Salvo on, right?
Yes.
And he said, listen, he goes, you're going to love next week. He goes, first of all, he goes, I'm a Sicilian, all right? He goes, I got a regal guy coming next week. Dr. Pepe is an incredible Napolitan. He's an amazing Napolitan. So not only are you a brilliant doctor specializing in shoulder and elbow and knees, but you're a great Napolitan as well.
Thank you.
Hey, which drew you? Be just curious. What where'd you grow up, and what drew you to this field? I'm so fascinated by you guys because you change people's lives. I say it all the time about angels, right? Because giving people the gift of walking and running and playing the stuff they love to play is giving a huge gift that we didn't have in the past.
Well, I mean, we've made a lot of advances, right, in sports medicine. I mean, you see these guys, they get back on the field fairly predictably, right, the pros. So our advances have been incredible. I grew up fairly athletic, playing sports. Grew up in Wilmington, Delaware, so I'm an Eagles fan. I've always been an Eagles fan. And to me, to take care of the team was a dream. It was great to get into it. And I always wanted to take care of athletes. And as a physician, it's satisfying to watch these patients, their players, and their patients, and to see them get back and play is something that it's incredible.
What did you play? What was your sport?
I played baseball, football growing up, some soccer.
That's awesome, man. That's fantastic. I love the fact that, and you do a lot of elbow and shoulder work. And how much did you pitch, by the way?
No, I did not pitch. No, I played third base when I played baseball.
There you go. Did you?
My arm isn't great. I saw you over there wiggling your shoulder.
Oh my! I have a 12-year-old travel player, so I'm constantly. Plus, he plays quarterback. So I mean, all I do is throw. We throw 5-6 days a week, and so I woke up this morning because we threw a little bit yesterday. I woke up this morning and I'm like, oh man, I can feel it. I can feel as I'm doing my rotator cuff. I can feel the creak. Like, oh man, how do you get that extension back? Oh God.
You got to work on it. You got to stretch.
I love it. What do you? What fascinates you, by the way? Because you specialize in shoulder, in elbow, and in knees. So that joint work. What fascinates you about repairing these joints?
Well, I mean, personally, doing orthopedic surgery is it's like carpentry, really, in one sense. Right, so you're operating on a joint, you're tying things together, you're suturing, you're putting screws in, we're putting plates in sometimes. So to me, I like that almost that feedback, that tactile feedback of doing something, fixing something or reconstructing something, right? To me, that's what I like about orthopedic surgery.
Well, listen, you found in your ancestors, right? The great carpenters of Italy.
Stonemasons, yeah.
Right? I mean, you think about it when it comes to that, it's the same vein. Let's talk about and again, every time we bring up an injury from a professional athlete, we always want to tell people that the doctors aren't their doctor. So again, this is all about injury and kind of understanding what the injuries are. So we talked about the Texans earlier and Stephon Diggs, who's out with an ACL. And I've had that ACL and I've had cartilage. Explain the difference. Like when you're thinking about the medial collateral ligament, which is your MCL, and your PCL, which sometimes in the back sometimes can go. So if you can explain the difference to everybody, because look, there's a lot of us out there that have bad knees.
Right. So the ACL and the PCL are two different injuries. Occasionally we see them both together when a knee is blown out and dislocates. But in the sports world, we typically see one or the other. So Stephon Diggs tore his ACL. I did pull up the video last night. It was a non-contact injury, right? He was going out for a route. He made a cut, and his knee gave out on him, which is 60%, 70% of the time. That's what happens.
Yep.
There's no hit. There's no tackle or and unfortunately, sometimes the body goes one way and pivots over the knee, and the ACL tears. Frequently, that happens with an MCL tear, the medial collateral ligament. They sometimes happen together. Occasionally, we have to fix the medial collateral ligament. Now, the ACL is the ligament in the inside of the knee, right? It's a cruciate ligament, so it basically crosses the PCL. And the ACL is responsible for that, the stability of the tibia coming anterior and rotating. So an athlete that tears an ACL, obviously to get back to athletics, needs surgery for it, as you know. So we reconstruct that typically with an autograft from the patient. We take a strip of the patella tendon, we drill holes, we fix the patella tendon in the area where the ACL goes, and the body grows into that ACL graft and makes a new ligament out of it. And typical return to play is 9 to 10 months in the NFL.
Yeah. It's amazing when you think of it. It used to be a death knell, right? It used to be to an athlete, that and the Achilles, man, that was it. Like your career was over. And now we see guys get back, within a year. It's just incredible, the advances now that you guys have that can save careers.
Yeah. And they get back fairly routinely. You rarely see a player that can't get back after an ACL. Now, the first season, they're never typically 100%, right? When they get back, they don't trust it fully, but they always take a tick down in performance. But these guys are so athletic and so gifted that they tend to overcome that and do well athletically. And
Doc, how much is the brain at play here? Like when you think about, because you see guys coming back from Tommy John, right? And it's the same thing. Like you don't know if you trust it. Like it takes a while. You bring up the ACL, and guys that have that kind of speed, how much is the brain to overcome that fear of trusting the repair?
It's a huge part of it. And the athletic trainers and the strength and conditioning staff for the team are a major part of that. And it's repetitive training, it's recovery, it's conditioning, it's restoring that athletic ability. And they all play a major part. And it's repetition. The player has to do position drills, sport-specific drills, and get back to their activities, and they learn to trust it. But you're right. I mean, they can get, if you golf, you know what the yips are, right?
Yeah.
And they can happen, and they overcome that with the athletic training staff of the team.
Yeah, I'm fascinated by it. But Doug Peterson coming to town, I'm sure you're an Eagles fan. That Super Bowl meant a lot, man. That was again the memory of all memories for all of us.
Oh, fantastic! I'll tell you, chills. Still get chills.
Where were you?
I was there. I was on the sideline.
You were actually on the sidelines.
Yeah.
Oh, wow! I knew you were. I didn't know you were actually on the sidelines. That's amazing.
I was one of the assistant docs. Yeah, back then.
Wow, that's fantastic. Yeah. So I know you have fond memories of Doug, who's coming back into town.
I was going to get a cheesesteak, Doug. You bet.
Doc, did you get a ring?
I have a ring. Yeah.
Oh, man. That's fantastic, great. Man. You're the best, Doc. What a pleasure, man. Thank you so much for hanging out with us this morning.
Thanks for having me. I appreciate it.
We all silly like the mayor.